Dear God, we glorify you for all the blessings you have bestowed upon us. We are truly grateful for them. Thank you for allowing us today to meet and share our knowledge and time with one another virtually. May you send forth your divine wisdom to our speakers as they impart effectively their God-given gift to all of us. May they be blessed as they continue to share their expertise to the people who needs them. Bless the participants as well, so that they would be able to obtain vital information from this activity. May you send forth your Holy Spirit so that after this webinar, we may share what we learned in the spirit of your love and generosity, especially during these trying times. May we be able to bring glory to your word in everything that we do. Amen.
A pleasant afternoon to all. I am Dr. Ria Fajardo, the National President of the Philippine College of Occupational Medicine, and I would like to greet everyone again, a pleasant afternoon on behalf of the Philippine College of Occupational Medicine National Officers and Board of Directors. We would like to thank the Hepatology Society of the Philippines President, Dr. Wendell Espinosa, and Vice President, Dr. Angelo Lozada, and as well as to the Department of Health and all the organizations and stakeholders for this collaboration on the celebration of Liver Cancer and Viral Hepatitis Awareness Prevention Month. Our utmost appreciation as well goes out to the speakers for this afternoon's webinar, Dr. Jose Gilain Catalunya and Dr. Felix Labanda Jr., and to our moderator, Dr. Eliza Hasse. Now, liver cancer and viral hepatitis continues to be an important public health issue as it also affects our workers, hence can affect the Philippine economy as well as the lives and livelihood of our workers. Join us this afternoon and throughout the month of January as we discuss important issues and updates on liver cancer and viral hepatitis and its effect on the worker and the workplace, and other special topics to follow in separate webinars. Thank you again, everyone, for sharing your time in attending this webinar. God bless us all in our endeavors for a peaceful and prosperous New Year this 2024. Thank you, everyone, and I turn over the floor to our moderator, Dr. Ella Hasse.
Thank you very much, Dr. Ria. Um, and introduced earlier, no, but I would just, though it's a bit late, but I would still want to um, pray was a group med University of Perpetual Health, Dr. Jose G. Tamayo Medical University. And she is a diplomate and fellow of the Philippine College of Occupational Medicine. At present, she is our national president for the Philippine College of Occupational Medicine, and she is also the medical director from the Perpetual Health Medical Center, Binyan. Now, this afternoon, I am tasked to introduce to you our speakers. We have two distinguished two speakers. First off, we have a graduate of Doctor of Medicine, College of Medicine, University of Santo Tomas, Faculty of Medicine and Surgery, Manila. He is a member of the Board of Director from the Hepatology Society of the Philippines. At present, he is a clinical faculty from St. Luke's Medical Center College of Medicine, William Quasha Memorial. He is also a member of the Fellowship Training Committee from the Institute of Digestive and Liver Disease from St. Luke's Medical Center, Quezon City. From the same institution, he is part of the Residency Training Core Committee. Colleagues, please allow me to let us all welcome Dr. Jose Gillian Catalunya. Dr. Jose Gillian Catalunya, for our second speaker, tutuloy-tuloy ko na po, no, para dire-diretso yung lecture nila this afternoon. He is a graduate of Doctor of Medicine from UERM Memorial Medical Center. He is a diplomate and fellow of the Philippine College of Occupational Medicine, and he had his master's in Occupational Health, University of the Philippines. Currently, he is the Supervising Labor of Employment Officer, Department of Labor and Employment. Previously, he was the medical officer from DOLE from 2018 until 2022 to discuss with us on the topic of administrative and DOLE standards in hepatitis B clearance. Let us all welcome Dr. Felix Labanda Jr. So for our first lecturer, may we please have Dr. Jose Gillian Catalunya. Dr. Catalunya.
Good afternoon. I'd like to thank the organizers of this Physicians Forum for this kind invitation. I'm Dr. Catalunya from the Hepatology Society of the Philippines, and I was tasked to give this talk on the clearance of the hepatitis B worker. So this is the outline of my lecture this afternoon. For the first part, of course, I'd like to highlight the hepatitis B burden in the country and that it is an important public health problem in our country. For this second part of this lecture, I'll discuss the objectives of why we need local guidelines and highlight the important aspects of these guidelines relevant to our day-to-day practice in the clinic. So I'll be discussing for the guidelines from the 2011 guidelines from the Hepatology Society in the Philippines on the evaluation of hepatitis B patients undergoing pre-employment evaluation. And on the last part of this lecture, I'll give a few cases, sample cases, on how to clear patients and how to make the employment certification. All right, so clearly hepatitis B is an important public health problem among Filipinos, and most of the infected belong to the 20 to 49 age group, comprising much of our workforce. And so the problem remains. So being the world's eighth killer, it remains to be underdiagnosed and undertreated for many patients. And although millions are infected and much is known about liver cirrhosis and liver cancer due to hepatitis B and C, only a third are aware of their infection and even less receive medical care and treatment. So this situation is graphically illustrated in this slide, where you can see that from the millions of those who are carriers of the virus, less and less go on to be diagnosed and have access to care, and even much less so gets to be treated. So therefore, there are many areas where we can improve care, and we need to make people more aware to be tested and be vaccinated. And we need to screen and know what tests to request for and how to evaluate these patients for treatment. So I'd like now to discuss on the hepatitis B and employment. And as I've mentioned, that I'll be discussing the guidelines on the evaluation of hepatitis B surface antigen positive workers for employment, which was developed by the Hepatology Society of the Philippines. So the main trigger for coming up with these guidelines on employment was the popular practice of screening for surface antigen in the pre-employment setting. And it is common to see a patient in our clinics who was declared unfit to work because of a reactive surface antigen test. And so the basis of this practice is probably unknown to many, but can be traced to a department order from the DOH many years ago, stating that screening for surface antigen be performed as required by prospective foreign employers. And this was passed on as a requirement even for local employment. And subsequently, because of this, there was discrimination, there was stigma and denial of meaningful employment to otherwise qualified workers. So this resulted, you're very much familiar with this, you see everywhere. So this resulted in a lot of ads such as these, which capitalized on those who are stigmatized and desperate to be employed. So what is the big deal in surface antigen patients or workers seeking employment? So there are basically two possible reasons. So one is a hepatitis B patient or applicant may develop illness while on the job, in particular can develop cirrhosis and its complications. And the second is a hepatitis B applicant may transmit the infection in the workplace. So although it is true that a surface antigen positive job applicant can be sick while on the job, the natural history of hepatitis B can be variable, and they can develop acute flares and progressive liver disease leading to cirrhosis or liver cancer. But then again, hepatitis B infection should not be treated differently from other chronic diseases such as hypertension or even diabetes, and they should be counseled and referred for care. And majority of patients with hepatitis B infection can live an otherwise healthy life, particularly when properly monitored and treated. So how about the risk of transmission to others in the workplace? So the risk of transmission of a hepatitis B applicant of hepatitis B infection from an infected worker to a person in the workplace is basically dependent on two main factors. So number one is the risk of exposure to the infectious hepatitis B particles in the workplace, which is primarily dependent on the type of occupation. And the second factor is the infectivity of the infected worker, which is dependent on viral factors, specifically the HBe antigen status and the HBV DNA viral load. So I would like to emphasize that hepatitis B has not been documented to be transmitted in ordinary workplace activities, even in food preparation, in coughing or sneezing, or even sharing utensils, plates, and glasses. So we know for a fact that hepatitis B infection is mainly a bloodborne infection and can also be transmitted sexually, but has not been documented to be transmitted in these activities or in these places. So in the hepatitis and in the HSP guidelines, we attempted to categorize the different types of occupations in these three main categories, as you can see here. So this table gives a summary of the types of occupations according to the risk of HBV exposure, where, as you can see here, category 1, comprising of the healthcare workers who perform exposure-prone procedures, and also those who work as commercial sex workers, poses the highest risk of transmission, while category 3 occupation comprise of the non-healthcare workers, and all the other occupations do not fall into the category 1 or category 2, and they pose the lowest risk of exposure to hepatitis B from infected workers. Now, category 2 occupation are those healthcare workers who do not perform exposure-prone procedures. So how do we define exposure-prone procedures? So basically, this is the technical definition. So EPPs, or exposure-prone procedures, are largely limited to the healthcare setting, and it involves the digital palpation of a needle tip in a body cavity, the simultaneous presence of the healthcare worker's fingers and a needle or a sharp instrument in a poorly visualized or highly confined space, or having uninterrupted vision during a surgical procedure. So that's the technical definition. So here you can see we've listed the different EPPs involved or performed by the different subspecialties and the different occupations, category 1 occupations. So the risk of exposure to infectious hepatitis B particles in the workplace involves EPPs such as surgical or invasive procedures, or in trauma procedures, in the nursing service, whether in the OR or ER, and dental procedures, and care of psychiatric patients. Okay, so again, this table puts all of this together and will be very helpful in the assessment for the risk of transmission of hepatitis B infection in the workplace. So again, we have categorized the infectivity of the surface antigen positive worker as either high or low, according to the HBe antigen status and the HBV DNA. So the cutoff, the magic number here is 2000. So more than 2000 IU per ml, high infectivity, less than 2000, low infectivity. So again, this table shows the risk of HBV transmission in the workplace, which is a composite of the infectivity of the worker and the risk of exposure according to the type of occupation. And as you can see here, that the only applicants who have work restrictions are those applicants who belong to category 1 occupations and those having high viral loads. Category 2 and category 3, regardless of the infectivity or the level of the virus, the DNA, have low risk of transmission. In category 3, even negligible risk of transmission, and should be considered and should be cleared as having low risk of transmission in the workplace. Okay, so to discuss it further, let's take a look at the algorithm. So basically, this is a simple algorithm that you can follow when you are being presented with a surface antigen positive um, uh, worker needing pre-employment clearance. So let's start off with that. Okay, so again, you determine first in the clinic whether that patient has complications, meaning to say if there are signs and features of hepatic decompensation or even liver cancer. Does the patient have jaundice, ascites, or any signs or features of liver disease as a hepatic decompensation from the hepatitis B infection. And definitely when with any complication of chronic hepatitis B infection, they are deemed not employable and should be medically managed. Okay. For those, of course, majority of these of the workers do not have complication, and so again, the first step is to identify the type of occupation, whether it's category 1 high risk or category 2 or category 3 occupation, which are considered to be low risk occupations. So let's go first. So category 2 or category 3, as I've mentioned, that regardless of the viral load, there is a low or even negligible risk of transmission. And so these applicants should not be denied work, and they should have no work restriction. You can outright clear this patient for employment. Okay. However, it's a different ball game in patients or in job applicants who belong to the category 1 occupation, or those healthcare workers who are directly involved in doing exposure-prone procedures. And so the first step, the requirement is for a surface antigen positive applicant applying for a category 1 occupation, we check for the viral load, okay, whether it's high or low. As I mentioned earlier, that a lower viral load poses a lower risk of transmission, and so you can clear this patient without no work restriction, as long as you are able to counsel the patient that he needs to be monitored closely. Okay. However, for the patients who have high viral loads of more than 2,000 IU per ml, they have a high risk of transmission, and so um, we cannot clear this patient for the intended occupation, and we have to specify the work restriction, particularly the performance of EPPs, and these patients should be further evaluated and should be treated according to the guidelines for treatment. Okay, so this is a very simple algorithm that you can follow. Okay, so the guidelines that I've been discussing eventually became the basis for a DOLE advisory, which came out in 2010 to stop discrimination against hepatitis B infected persons applying for a job. So I think this will be discussed in the second lecture, but just to brush off on the most important points in here. So the first statement is that a hepatitis B surface antigen result should not be a sole basis to discriminate or restrict or disqualify a job applicant from being gainfully employed. And a hepatitis B applicant should not be declared unfit to work and denied employment without appropriate medical evaluation and counseling. The second statement is that hepatitis B screening in the pre-employment setting should not be made mandatory, and screening should be performed only if applying for occupations at high risk for transmission, such as in category 1 occupation in the workplace. And lastly, the minimum requirements for a confirmed surface antigen positive person undergoing pre-employment evaluation should include HBe antigen and anti-HBe, serum ALT, and an ultrasound of the liver to check for presence of cirrhosis or even liver tumors such as liver cancer. And so this is now what we need to write on in the specific clearance that we will be given for the patient. So in the pre-employment clearance, we need to indicate, so these are the most vital information that we need to put in. So we need to put in the specific phase of the chronic hepatitis B infection of the applicant. We need to specify the risk of transmission, whether high risk or low risk, in terms of its the type of occupation and the viral load. And then we now put in the recommendations for employment and the limits of this clearance, whether we are clearing the patient for employment with no work restrictions, or if the applicant is cleared but with work restrictions, and we should specify the specific work restrictions, in particular, the exposure-prone procedures that the patient is restricted to do. And then if not cleared, we need to state the reason. For example, if the patient is the patient has signs of hepatic decompensation, then we should state that. And then we need to put also our plan for monitoring in terms of the biochemical tests that we need, or ultrasound, and the frequency, and the plan for follow-up as well. Okay, so I think this is the last part. So I'll give a couple of cases so that I can guide you on how to write the pre-employment clearance for these applicants. So, okay, so the first case here, so we have an applicant applying for a sales representative job. So first we determine what type of occupation. So this is a category 3 occupation, low risk, and is not involved in performing exposure prone procedure. And the initial workup for this particular applicant showed a positive surface antigen, a negative HBe antigen, and a positive anti-HBs, and a normal ALT. So the first step here is to give the complete diagnosis or the status of the hepatitis B infection. And so with this, the patient surface antigen positive and a positive anti-HBs, a negative HBe antigen. And so this patient has chronic hepatitis B with immunity or recovery, with negligible risk of transmission based on the intended occupation, which is a category 3. Okay, and so the next step here is to put in the recommendation, whether you can clear the patient with restriction or with no restriction. So you can state it as this. So we may clear the patient for employment as a sales representative, which is a category 3 occupation with no work restriction. And our recommendation would include a close monitoring, at least with an ALT every 3 to 6 months. Okay, so this is for a low risk occupation. Okay, so another example here. So this is an applicant applying for a nursing position, so a nurse. So of course, a nurse is under the category 1 high risk occupation, healthcare workers who directly perform exposure prone procedures, category 1. So these are the workups that have been done for the patient. So a positive surface antigen, also a positive HBe antigen, relatively high effectivity, together with an HBV DNA of 7,560 IU per ml, relatively high viral load, negative anti-HBe, and also a negative anti-HBs, and a relatively an elevated ALT at 90. Okay, so category 1, and then we need now to determine the exact status or the diagnosis of the hepatitis B infection. So in the guidelines, this is labeled as HBe positive chronic hepatitis B with high infectivity because of the viral load and high risk of transmission, based on the intended line of work, which is a Category 1 occupation, being a nurse. Okay, so what would now then be our recommendations? Of course, we need to specify whether we can clear or not clear this patient. So cleared for employment as a nurse, but with work restriction. Since this patient doesn't have, this seem to have any hepatic decompensation or complication, we may clear the patient, but we need to explicitly state the work restriction. Okay. The applicant, you may put here, the applicant is not allowed to perform exposure prone procedures. Then you can further specify those which are related to the occupation, being that. And then lastly, we need to put in our recommendations. Um, um, if the patient qualifies the criteria for treatment, then we may put in there recommend treatment and a re-evaluation after 3 to 6 months. So I guess in the guidelines, given the nature of the occupation, we may recommend treatment already for this applicant, and of course reevaluation again after 3 to 6 months, and then we can redetermine again whether we can re-clear the patient and then determine if the work restriction would still be needed. Okay, so yes, I guess those are just a couple of classic cases that we encounter. So again, this algorithm is very useful. It's very simple to analyze as well, no? So I hope everyone got that. So I think that's the last slide. So I'd like to thank everyone for your kind attention, and I'm looking forward to the Q&A. Thank you very much.
So thank you very much for that. I'll just be sharing my screen. Host, can I share my screen, please? Thank you. Dr. Lazada, can I request for I be allowed to share my screen? Thank you. So while waiting for that particular technical, there you go. Okay. Okay, so you're seeing my screen on presentation view. All right. Good afternoon to everyone. Welcome to this afternoon's discussion. So since Dr. Cataluna already provided a discussion on how you're going to handle clearances for those that have hepatitis B, let's also provide a perspective on what hepatitis B means for those that are going into workplaces. So at the end of the session, the participants are expected to be aware of our government institution protection measures regarding hepatitis infection, especially for our workers. Now, it is very important that you also determine why, or you have to provide employers, especially for those that are working in for physicians in the workplaces, you have to provide the HR, you have to provide the CEOs on why there should be a need for support for those that have hepatitis B. So based on the Hepatology Society of the Philippines, about 7.3 million adult Filipinos are chronically infected with hepatitis B, and this is 16.7 of the adult population. What does this mean? So this means that the country is currently in the hyperendemic state for hepatitis B. That would also mean, based on also on the data from the Hepatology Society, the affected persons are those within the 20 to 49-year-old age group. These are the productive ones. So these are persons that most likely would provide a high contribution to the gross domestic product of the country. So in December of 2010, the Department of Labor and Employment provided Department Advisory Number 5 series of 2010, which provided the guidelines for the implementation of a workplace policy and program on hepatitis B. In the sa department advisory, we noted that hepatitis B is not spread through the usual workplace activities, and the job of most workers do not confer a risk of transmission for hepatitis B. Hence, workers need not be screened routinely for hepatitis B if the risk of transmitting hepatitis B to either the clients, their fellow workers, is low. So currently, many job applicants for hepatitis B surface antigen positive are declared unfit to work before they're even evaluated and they are even counseled. So with the advent of the mental health law, it is very crucial that those that are that we think are infected with hepatitis B should also be looked into. Their mental health should also be looked into, because these patients are the breadwinners. They could be your sister, they could be a brother, a mother, or a father, and this affects the core of the society. So it's important that it's not just about hepatitis B and the work. No, it's about hepatitis B and the worker. And the worker, we should not leave out the fact that they are humans and they are interrelated with other members of society. So the impact of a person being labeled as hepatitis B positive and not fit for any work, because Hepa B is confused with Hepa A, is very, very critical. So it has to be that particular information should be cascaded as much as possible to those that are decision makers, but are unfortunately some of them are not versed with the difference between Hepa A and Hepa B. Now, it is said in the department advisory that all establishments in the country shall have a policy and program on the prevention and control of hepatitis B in the workplace, regardless of the size and the type of industry. So it doesn't matter if it is somewhere in Luzon, Visayas, or Mindanao. As long as you are an industry, there should be a policy and program on the prevention and control of hepatitis B in the workplace, primarily because a policy and program should be a guide to prevent discrimination, should be a guide to prevent unnecessary testing, because you are already guided on what should be done. So when you are when company or workplaces create the policy and program, there should be a guidance. So usually our primary guidance would be the International Labor Organization's decent work for all. So in the first column, you can see that the rights at work aims to promote and realize standards, fundamental principles, and the rights at work. And one of the fundamental principles is actually human rights. So when we say human rights, we have to. It's very important that in the 1960s, the Philippines ratified or agreed with Convention 111 of the International Labor Organizations, stating that discrimination shall be eliminated as much as possible. So when you say discrimination, what does it mean? So this discrimination is any distinction, exclusion, or preference made on the basis of race, color, sex, religion, political opinion, national extraction, or social origin. So it has the effect of nullifying or impairing equality of opportunity or treatment in employment or occupation. So this definition from 1960 still stands up to today. So definitely, we don't want any part or any member of the workforce to be discriminated just because they have a particular condition. Now, this particular slide shows us the components of an occupational safety and health policy as required by the Occupational Safety and Health Standards and the Department Order 198-18 empowered by Republic Act 11058. So in this particular policy and program under number 3 components, it is important to note that uh, there should be advocacy, information, education, and training, or an avenue to reduce stigma to ensure that the policy on hepatitis B in the workplace is accepted by everyone in the workplace. So the Philippine Action Plan to Decrease Global Hepatitis B Disease Burden, which is WHO aligned, started in 1998, during which time hepatitis B vaccine was integrated into the expanded program of immunization. In 1992, routine vaccination for target 40% infants was started. And in 1994, RA 7846 series of 2006 appropriated the compulsory hepatitis B immunization among infants and children less than 8 years old. In 2010, RA 10152 mandated that infants and children become immunized for hepatitis B. Why are these dates very important? Because 1990, 1992, 1994, and 2010, these are already part of your workforce. So almost that the 2010, the Republic Act of 2010, so these are the ones that are a bit younger. So they're more or less 14 years old, but those that are in the 1990s to 1994, these are already our current workforce. So the efforts from the 1990s affects our current workforce now. Moving forward, what do we want to happen? So we want to ensure that those that are going into the workforce is actually screened or diagnosed as necessary. There should be no legal prohibitions for their screening, meaning if you're going to screen, is it appropriate or not? That doesn't mean that you can screen, you will screen. So there should be a distinction on why are you screening in the first place? Because screening without knowing why you're screening actually produces a lot of cost, and also produces a lot of anxiety for those that are undergoing the screening. Now, when we say we want to screen, you have to determine why you're screening, because if there's no screening that's going to be done, there's no need for clearance. Okay, that's essential. Now, what if the physical examination shows signs and symptoms of liver problems? So there's jaundice, there is a there's a change in the veins of our worker, then the clearance for a hepatic pathology could be done. Now, when this happens, there is no discrimination, because it can be alcoholic liver, it could be fatty liver, it could be anything from that. And since there's already a pathology, you're trying to determine the fitness for work, given that this worker is not actually 100% okay. There's a slight problem, given that there might be an inflammation of the liver, or there might be a shrinking of the liver. Now, this is true only for those that are going to be employed domestically, meaning those that are in our local workplaces, as well as those that are in ships that are flying the national flag, meaning the Philippine ships. So like the ferries that we have, that is locally binding, locally bound by our laws. However, for those that are going to work overseas, or going to study overseas, if there is a screening for hepatitis B, then we are bound by the rules of the country that is going to host this particular worker or student. Now, the approach of the Department of Labor and Employment is to create an interrelation of our policies, as well as our inspection checklist. So the occupational safety and health has several components. So definitely, occupational safety and health also involves accidents and injuries. However, for our purposes, let's focus on the diseases. So for non-communicable disease, there's the mental health in the workplace, drug-free workplace, and the National Integrated Cancer Program. On the other hand, the communicable diseases such as TB in the workplace, Hep B in the workplace, and HIV and AIDS in the workplace are present in the policies and programs under occupational safety and health. Why do you need to know this? this is critical because yeah, this is critical because in our labor inspection checklist, so this could be easily viewed through bwc.dole.gov.ph /labor inspection. So you can view the latest labor inspection checklist that we use when going to workplaces. You can see that under OSH indicators, we are looking at policies and programs on the promotion on drug-free, mental health, and healthy lifestyle, as well as policies and programs on the prevention and control of HIV and AIDS, tuberculosis, and hepatitis B. Why are these lumped together? Because the concept is an all or none principle. Because if you are not providing a policy and program for a particular disease, for example, hepatitis B, then definitely and you're only providing for HIV and AIDS, and definitely it's an avenue for discrimination. We cannot say that you are protecting your workers completely when you are actually have lapses in the policies and programs that is required by the government. Now, when we have these policies and programs working hand in hand, we make sure that we are combating non-communicable diseases as well as communicable diseases. However, if one of that particular policy and program is missing, then definitely our control of NCDs and CDs will definitely be not be present. Now, given the fact that some of our workers may eventually develop hepatitis B, be it through their course in the workplace or from the community, we as physicians need to determine what is the reason why you are sick in the first place. So documentation is very important, especially since we are not advocating for screening. So when we say documentation, we are just looking for what is the job description of the worker. Dr. Cataluna a while ago mentioned about several categories of work. So it's important that you review what is the job description. It is not enough that you ask, oh, what are you going to do? Are you a nurse? Oh, what type of nurse are you? Are you going to be an OR nurse? Are you going to be a charge nurse? Or are you going to be a nurse, but you're going to be staying in the pharmacy? So there's a difference. Now, the reason why we want to do that is because the Employees Compensation Program provide or categorize hepatitis B as an occupational and work-related disease. However, the compensability of this particular disease depends upon several conditions. So if it's for viral hepatitis under Board Resolution 247A, published in 1977, it's only considered as a work-related disease if it's among workers in close and frequent contact with human blood products and with source of viral hepatitis by reason of employment in the medical treatment or nursing of a person or person suffering from viral hepatitis or in a service ancillary to such treatment or nursing. Additionally, in 1981, under Board Resolution number 1676, working conditions already listed under PD 626 or under the Employees Compensation Program, as amended, any occupation involving exposure to a source of infection through ingestion of water, milk, or other foods contaminated with hepatitis virus, provided that the physician determining the causal relationship between the employment and the illness should be able to indicate whether the disease of the afflicted worker manifested itself while he or she was so employed knowing the incubation period thereof. Now, why is this very important? The distinction here is, in number 13, the viral hepatitis is because of the work. Okay. In number 28, the reason for the viral hepatitis or having hepatitis, this is not very particular to hepatitis A or B, right? So the reason for viral hepatitis in number 28 is that it is ancillary. It is something related to the employment, but not necessarily directly the employment. So, for example, any intake of water, milk, or other foods contaminated with the hepatitis virus may elicit a viral hepatitis, and this should be documented. And the documentation is actually going to be part of an occupational safety and health investigation. For those that, for the physicians that are in the health centers or in our municipal health centers, um, the the course of how the patient got the infection is very important. For those that are in workplaces, our occupational safety and health investigation should be inclusive of activities that may happen in in the course of doing their work. So for example, if they needed to go to lunch or they ate lunch outside of the workplace, where did they get their lunch? So or if they are infected with hepatitis B, where were they injured? So for example, they handled glass which was also pierced another person. So for example, like that. So this should be documented, and this is very crucial for the approval of the employee's compensation. Okay, so it can happen anywhere. Now, this should also be reported to the Department of Labor and Employment through the annual medical report form. So if there's an immunization program, you should indicate that there is an immunization program going on. So there is a so here just indicate if there's an hepatitis B vaccine that was administered to your workers, especially for those in the healthcare setting. Okay. Now, so, right. So, at okay. So, upon review, I think for those that are attending this particular webinar, you are made aware of the government instituted protection measures with regard to hepatitis infection, and that your role as a physician is not just to treat them on what they are already complaining about. So, for example, if they have jaundice or what, but you also have to consider their mental health status as well as their future employability. Dr. Cataluna a while ago mentioned that there are certain clearances that you could provide, and there would be work restrictions. However, you should also consider um, other potential sources of injury. For example, the worker works with a company that has several chemicals. So, what are the chemicals that are being inhaled, and is there going to be any effect on the liver? So, those things should be considered when you're asking your worker on the type of work that they do, right? So thank you very much for your kind attention. There you go.
Okay,
Good afternoon, Dr. Hase.
thank you very okay. Thank you very much, Dr. Catalunya and Dr. Labanda Jr. Hello? Naririnig po ako.
We can hear you. It's a bit choppy from my end. I'm not sure from Dr. Cataluna's end. If you can hear her.
The same po, a little bit choppy.
Choppy.
Medyo choppy.
Medyo choppy ka.
Siguro po dumadaan ng mga eroplano.
Sige po.
But I'll try to make it. But please allow me to read the questions.
Dr. Hase, may I recommend
So
pa-play
the
off na
first
lang po
question
nung
is
video.
from Dr. Ronico.
Yeah, we can
Okay.
we can hear you. We can hear you properly.
Yeah. How about now? Better po?
Yeah, better po. Better when the video is off.
Better
Thank
po?
you. Yes. From
Yeah,
my
Okay.
but better with
Thank
Dr.
you.
Yes.
Sige
Yep.
po. So, we have the first po. Thank you very much, Dr. Catalunya and Dr. Labanda. Okay po. So for our next for our first question, coming from Dr. Ronnie Baticos, I guess the first question would go to Dr. Cataluna.
Yeah.
Is there a need or need po ba ipamonitor ang Hep B DNA? And if there is a need, how often?
Okay. Well, technically, for employment purposes, again, it shouldn't be low risk occupation. It shouldn't be a requirement technically, but I know that these workers also undergo yearly annual checkups, at least in most of the companies. And so one of the tests there, I think, would include ALT. Well, ideally, if but I think they should be out of pocket already for the worker. But if you have a surface antigen patient, even in a low risk, ideally at least every 6 months or a yearly HPV DNA, especially when you see that there is an increasing trend of your ALT or worsening. Will we do now liver elastography also for screening for fibrosis? We can, if there is a significant increase in the liver fibrosis score of the patient, then we can do the HPV DNA every 6 months to 1 year. But again, it shouldn't be a requirement given the low risk occupation. But ideally, we should every 6 months to 1 year.
Okay, thank you, Doc. So just to confirm, if there are HBsAg positive patients or ito po, mataas ang ating ALT, that's the time that we will do HBV DNA and possible elastography. No po, and if we have to do that one, pwede po siyang every 6 months. Tama po ba?
6 months.
Okay, thank you very much, Doctor. So for our next question po, who should shoulder the further evaluation of a Hep B positive employee if it is still for pre-employment? So nag-positive na po sila, di po ba? Pre-employment pa lang po ito. Of course, di po ba, base po sa inyong algorithm kanina, we have to further evaluate the patient. I guess this question would also go to Dr. Labanda. Ito po bang yung further evaluation, sino po ang mag-holder ng cost?
Okay, so ang rule of thumb po natin dito, whoever required the test should pay for the test. Yun ang rule of thumb natin eh. So, halimbawa, sa ating pong occupational safety and health standards, pag ito po ay inyong binasa, ito po ay shouldered by the employer. Yan po ang nakasulat, Rule 1960. However, industry practice, ang medical po talaga, na regular ito yung chest x-ray natin, CBC, urinalysis, physical exam, usually mga worker ang nagpapagawa niyan para makapasok na sila dun sa work na gusto nila. However, ang hepatitis B screening or HBsAg is actually a test that is not even mentioned in the OSH standards. Sinasabi lang siya actually ng Department Advisory 5 na bakit mo siya nire-require? Ano ang particular nature ng iyong work or ng iyong industry na nagre-require ka ng HBsAg? So definitely, if you're requiring an HBsAg screening and you require further evaluation of it, it should be in your policy. Hindi ka naman pwedeng mag-require na, sige, magpapa-chest x-ray ako and then after lumabas na positive for tuberculosis, hindi mo na, automatic, re-reject mo na yung worker. Kailangan po, meron talaga tayong policy and program. That's the reason why we're having the particular policy and program written down para alam natin why are we doing it, what is our legal basis for doing it. So, if for example, a particular company requires HBsAg testing, so halimbawa nurse, puro siya, papasok siya sa OR, ni-require ang HBsAg testing. Ang further evaluation niya ba ay para ma-ensure na ito ay maka-classify niya further kung ang ating worker ay saan parte ng ospital pwedeng ilagay? O is it going to be a further evaluation para lang po ma-discriminate further? Kasi ang further evaluation mo ay to ensure na maproteksyonan mo yung worker from further harm or maproteksyonan mo yung coworkers na sila ay ma-infect. So kung ang purpose po ng further evaluation ay nakasulat doon sa ating pong policy and program, then definitely kakayanin naman po na ito ay sagutin ng employer. However po, pag ang nag positive sa HBsAg, pero ang gustong malaman, so ano po yung susunod kong gagawin? Nag-recommend si doktor, sabihin ni doktor ay kailangan po natin magpa-ultrasound ng liver. Ang susunod po na magsasagot na niyan ay yung manggagawa po. Bakit? Kasi ang sinanap lang po sa kanya ay HBsAg screening. Hanggat hindi po ang employer ang naghanap ng particular test, hindi po ito pwedeng ikarga sa employer. Okay? Kasi minsan yung elastography it's not cheap. Imagine niyo 15,000 workers sa isang call center. Pag sinabi mo HBsAg in a call center, bakit? Primary job description ba nila ang makipagtalik sa isa't isa? Hindi naman. So I think that would not be part of the requirement.
Thank you very much, Dr. Labanda. So ulitin ko po, no? Yung HBsAg ay i-handle po ng ating employer. But further
Depende
evaluation
kung sino
as
nag-require po ng HBsAg.
kung sino po nag-require. Opo, kung sino nag-require. And then further evaluation, of course, is depende din po yan kung ano po ba ang polisiya na isina-add doon sa kumpanya. Ano po?
Yes.
So with that, ay follow-up question po ito na nakita ko na din dito kanina. So to begin with, dapat po ba kasama yung HBsAg examination sa pre-annual and annual medical exam?
Okay. Dr. Cataluna, ako mag-start na ako nito kasi definitely for on the part of DOLE, we think that this examination, katulad nung minention ko kanina, you have to decide to screen or not to screen. Because if you're screening to heal, if you're screening to treat, then definitely go for it. You screen. But if you're going to screen a normal adult individual just for the sake of screening out, then definitely that's discriminatory. Imagine niyo po, mental health in the workplace. Gusto niyo po ba lahat ng papasok ay mayroong mental health examination para yung mga merong psychosis during the time of examination ay ma-eliminate mo or ma-rule out mo na or matanggal mo. So it's very discriminatory. Ang sa amin po, if it's not critical, katulad na nabanggit Dr. Cataluna kanina, several categories ang ating pong workplaces. Kung hindi po kayo nagfo-fall dun sa highly critical or mataas ang probability na mayroong pong transmission of hepatitis B, then there should not be a need for hepatitis B screening. Dr. Cataluna?
Thank you,
thank you
Dr.
for that.
Labanda. Dr. Cataluna?
Yes, nothing, just a little more to say, but yeah, I very much agree with that, no? With the addition of the surface antigen testing, our stand would be just to require it at least in the category 1 occupations, which would be dealing with exposure prone procedures, but because that is critical in the job description. But otherwise, even in healthcare workers would not be in the specified applied for position if no EPP, and more so in category 3, I don't think we need to require the surface antigen testing.
Actually, from what I could imagine, not everyone in the hospital requires an HBsAg. So if, for example, you're in admission, you're an admission clerk. So what is the purpose of an HBsAg? So it doesn't really, the job description is very important, not the job location, not the workplace, it's the job description. What are you actually gonna do?
Agreed.
Thank you, doctors. Doc, sa-segue lang ako for question for Dr. Cataluna. So, kadalasan po kasi, di ba, Hep B. But meron po for the, yan po, sinabi natin, di ba, yung mga EPP, exposure-prone procedures na population. Kailangan po ba Hep B lang or dapat kasama doon yung Hep C sa mga merong EPP?
Yeah, very, very good question. So, viral hepatitis, the B and C are bloodborne. So technically, it should be a part of the screening also, but I didn't include it in the lecture already because I was restricted to discuss Hep B. But especially in applicants with significant risk factors, um, drug history, history of tattoo, unprotected sex, especially commercial sex workers. They do need clearances as well. Then, of course, we need to add in the screening for hepatitis C. So, screening for hepatitis C, we just need the anti-HCV together with the surface antigen testing. So, that alone, that's enough for screening for hepatitis C.
Okay, thank you po, Doctor. Si ano po, pinilit ng employer, kailangan mag-screening. Eh, ano naman sila, hindi naman sila part ng population. Dapat po pa rin bang gawin? Pinilit ng employer. Hindi kami, kasama siya. Pagawa pa rin natin ng HBsAg. Dapat pa rin po bang ipagawa siya as part of the pre-employment?
Okay, sige. So dahil ito ay employer na ang
Dr.
nagsabi na
Labanda?
since employer na ang nagsabi na kailangan meron kang HBsAg, ako naman ang magbabayad. Now the question is it legal for them to require it? Pangalawa, what is the purpose? Usually, kapag meron po tayong employer na nagre-require ng HBsAg at sila ang willing magbayad, ibig sabihin nun, meron po silang particular na need why they want to know because they're actually spending money on it. Diba? Kasi ano yan ang mga businessmen po natin, hindi sila basta gagastos ng pera for something that they could do away with. Yung urinalysis nga, pinipilit nilang ipatanggal sa amin because baka naman pwedeng tanggalin, baka hindi na siya kailangan. So definitely, when HBsAg is being required and is going to be paid for by the employer, then baka tingnan natin, baka kailangan nga talaga doon sa job description. So there should be a review of the job description, what particular job or what the particular aspect of the job exposes me to particular infection or exposes others from my blood. For example, if there's going to be, like in manufacturing, if there's going to be a higher risk for wounds, example in canning, sometimes there are machines that have a high disposition for cuts. So there may be a risk. However, for companies that require HBsAg testing to be shouldered by the employee, by the worker or by the employee, then there should be a question. If you think that it is not right or it is not legal, for example, you are manufacturing but you are in printing, so definitely there's not going to be any transmission of blood and blood products. Then you can question it or you can advise the Dole Regional Office that such a thing is happening because definitely we can't monitor the 1,800 establishment, 1,800,000 establishments of the country. So that being said, if you think that the HBsAg is there and it is wrong, it is being asked unnecessarily, you could inform the Department of Labor and Employment because again, this is a form of discrimination. So that the DOLE would definitely go there or schedule an inspection and ask for the policy and program. The policy and program would be a determinant on if it's legal, what is the basis for the screening.
Thank you, Dr. Labanda. We have a question here from Dr. Omet Punongbayan. Where can the worker complain discriminatory acts and what are the possible actions of DOLE?
Ayan, sige. Discriminatory acts, dalawa po ang klase nito. So, when a worker, so it's already employed, worker na siya nandun na siya sa loob ng kumpanya, is complaining of discriminatory acts, pwede po siyang lumapit una sa DOLE Regional Office kung nasaan po yung location ng kanya pong establishment. So for example, you were hired by a company in Pampanga, but the head office is in Makati, you report to the DOLE in Pampanga, not in NCR, because it's there has to be a team that will be going to the company. Now, if there is an applicant for a workplace that is going to that's complaining of a particular situation, pwede rin naman po magpunta sa NLRC, National Labor Relations Commission. Pero kung ikaw ay gusto mo talaga na one-stop shop, kumbaga, pwede naman pong pumunta sa DOLE Regional Office. Ang mga regional offices po natin ay may tinatawag na SENA or Single Entry Approach that would allow for a peaceful resolution of a particular complaint. Kasi sometimes the complaint stems from hindi nagkakaintindihan lang si employer at si worker dun sa kanilang gustong mangyari. So yung possible action po lagi ni DOLE is always an out-of-court settlement, pero kapag hindi po talaga kakayanin, there might be legal actions against particular individuals responsible for a violation of the department's advisory.
Okay, thank you, Dr. Labanda. Ano po? So, minsan kasi mabilis tayong magalit, no? Especially pag merong mga ganyang ang tingin natin we are being discriminated. But again, the role of the DOLE is really to make sure that there's a fluid relationship between the employee and the employer side. Ano po? So, kung kaya naman pong i-settle, let's settle it. We have another question here. I think this is for Dr. Cataluna po. Dr. Cataluna, if the viral load is still very high, of course, bibigyan sila ng sick leave. How long can they be on sick leave?
Okay. In clinical practice now, when we have a patient with a relatively high viral load and is indicated for treatment, we usually recheck after starting on the antiviral treatment of your choice, we usually recheck the viral load and the rest of the liver profile after 3 to 4 months actually, because we expect the virus load to go down. No, um, um, that's how we usually do it in clinical practice. But then again, I think I'll throw this question to Dr. Labanda with regards to the provisions for the sick leave for that applicant. No? But in practice, that's what I can say, that we usually check the viral load after 3 to 4 months after initiation of the antiviral treatment.
Okay, sige. I'll catch that, Dr. Cataluna. I think the thing that we have to consider here is if the patient or if the worker needs to go on a sick leave because needs to follow up with the physician, needs to have their workups done, then that could be a time for which we could provide the sick leave. However, again, 4 to 6 months after an initial check, you will recheck what will the patient be doing in that span of time. Remember that in the labor code of the Philippines, there is a provision for medical termination. If a worker is not able to return to the workplace because of a medical condition for 6 months, it would the company may initiate a medical termination. So what is a medical termination? It is a means by which a worker is separated forcefully from employment due to medical reasons. But however, this could not be enforced immediately because you need an expert's opinion from a government facility. So when you say a worker is going to be medically terminated because of a pathology of the liver that renders the worker unfit for a particular work, then that would require a certificate coming from a government physician or government physician. We call that a specific for the particular situation. So for our case, it has to be a gastroenterologist or a hepatologist. It cannot be a surgeon. It cannot be a dermatologist. It has to be specific for that particular disease. Now, when we are providing medical certificates for absence, we're actually vouching for the worker that they are actually sick during that time and they are availing of sick leaves. However, let us not be too magnanimous in giving out sick leaves left and right, primarily because some of our sick leaves render our workers unfit for work, meaning they don't have any living wage during that time. You also have to consider, we ask the patient, if you are going to be on sick leave, for example, for 4 months, how is your company going to handle this? What is your role? Is it critical? Maybe we could do a repeated sick leave, meaning if there's going to be a repeated scan every 2 weeks or so, then you can have a sick leave every now and then. However, if the worker really cannot go to work because of a liver pathology, rendering that particular worker unable to keep a healthy working environment, meaning non-functional talaga siya, pwede mo siyang i-unfit to work. However, babagsak po kasi yung kanyang metrics and that would be tantamount to a parang nyo siyang slowly tinatanggalan ng capacity to work eh. Siyempre nandun tayo sa employment preservation. However, kung ang inyo pong medical certificate ay nagsasabi na 5 months naka-leave si worker dire-diretso kasi uuwi siya ng probinsya, technically, para nyo siyang pinagpapahinga ng permanente. Kasi halimbawa yan ay isang baker sa isang bakery. Hepatitis B, okay lang naman, hepatitis B eh. Kahit baker po yan, pwede siya mag-work. Pero kung siya lang ang baker doon sa bakery na yon at pinag-leave nyo siya ng 5 months, wala na po yung babalikan na trabaho. Sarado po yung bakery or kumuha na sila ng panibagong baker. So importante rin po yung interplay ng worker at saka yung kanilang working conditions.
Thank you.
Thank you very much po, doctors. Meron pa po tayong further questions here. Medyo madami-dami pa. Kaya pa po, doctors.
Oh.
Okay. So, question from Dr. Michael Nueros. My question is regarding the requirement for health card for employment from the LGU Health Office, wherein some are requiring A and B tests, Hep A and Hep B tests. Will they be giving clearances if they encounter positive Hep B, or do they still need to be further evaluated prior to issuance of the health card?
Dr. Cataluna, would you know the answer to this?
A and B po ang tinanong niya. So that means pwedeng ang nag-positive po ay A or ang nag-positive ay B.
Well, the health card,
The LGU Health
Ano po,
Office is asking.
LGU po eh.
so that's a
Opo.
local
Kadalasan po
local
kasi
host.
pagka ganitong LGU ang
practice.
nagre-request, mostly may sanitation na concern po yung company po.
Okay, so from experience na lang, Dr. Catalun, I'm not really sure. There are several physicians in the webinar that are labeled as MHOs. So for the MHOs that are in the webinar, baka mas alam niyo to, pero from my experience, nagre-require sila ng HEPA A for those that are in the food industry. Nire-require yan bago sila magbigay ng health card, kasi yung health card nakalink po siya sa business permit. Okay, kailangan lahat ng worker niya merong health card para ma-issuehan sila ng business permit. Yung HEPA B, during the time that I was starting my medical career, uso pa siya na hinahanap ng mga health officers. Pero nung ako ay nag-concentrate na sa mundo ng occupational medicine, I hardly see an LGU requiring a HEPA B test. Ang madalas na na-encounter ko, lalo na sa food industry, lalo na doon sa Masayang Bubuyog, nire-require ay HEPA A. Yun yung na-encounter ko sa mga
Napaisip tuloy ako
LGUs.
sa Masayang Bubuyog.
Sa akin naman, personal experiences, those applying in municipal health office, health centers or city health centers, well, basically still the high risk occupation, they would still require the Hep B screening at least.
Ano kaya ang basis nun kay
Mostly
Dr.
sa mga
Cataluna? Hindi ko
province,
hindi
actually,
ko
Doc,
maano
di
yun
ba?
eh.
I think it depends on the LGU policy guidelines. That one I cannot
Policy.
really answer as well.
Hindi, sa akin din hindi ko ano eh. Even for DOLE, we have no control over what the LGU requests. Depende sa kanila kasi yan. So,
Opo.
may local
But
civil may local code.
baka po meron tayong attendees, no, from the LGU. Maybe they can shed light on this one. But other than that, tama naman po, we should have a basis for requesting this. So siguro ang isang question doon ni Doc ay, actually yung question niya is nag-positive, di po ba? So hindi pa sila mabibigyan ng clearance. Kailan natin siya dapat ipaulit para ma-clear na? Any, ano po? Any?
HEPA A? Di ba HEPA A self-clearing siya for 6
Yes,
months?
so depende sa status ng Hep A, but mostly naman Hep A is chronic. Once you have that certain IgG antibody, you're immune for life, so you can clear the patient anytime.
Okay. Thank you very much, doctors. So next question is from Dr. Bangalan. Regarding our OFW kababayans who will be testing positive sa screening, ano po ang experience niya regarding their clearance? Kasi
Okay,
mas strict
so
po
ako
yung sa
sasagot
mga
niyan to.
OFW.
OFW OFW. Sagutin ko to. So for OFWs po, kapag ni-require po sila ng accepting country, accepting ship, accepting platform, flying an international flag, kapag HBsAg positive po ito, automatic po rejected po sila. Medyo ano po, medyo harsh po 'yun eh. Alam po natin based on ano kasi ano po sila eh, ang international colors po natin sa mga ships, sa mga oil rigs natin, very critical po sa kanila yung hepatitis B. I'm not sure why, but since it is required by the country, yun po ang ating susundin. Now, doon naman po sa ito ba ay absolutely hindi na sila pwedeng mag-apply. So alam natin that HBsAg, if it turns positive when you're an adult already, the probability of it reverting to negative is there. So hindi po absolutely hindi ka na makakapag-apply sa ibang bansa or sa barko kung ikaw ay nag-HBsAg positive. However, for that particular application, you may be denied. So pupunta na lang po kayo sa inyong hepatologist para magpa-advise kailan po ako pwedeng mag-apply uli. Ito po ba ay acute or ito ba ay chronic? So, syempre nandun na po papasok yung guidance po nila Dr. Cataluna na, ito ang gagawin mo. Ito ang diskarte natin dyan. Kasi syempre, yung pagtatrabaho po natin sa ibang bansa, like our OFWs, hindi po siya, hindi siya mabilis lang eh. Medyo matagal din ang processing na yan. So, baka by the time that they are reprocessing, negative na sila.
Okay, thank you, Doctor. Siyempre, di po, parang katulad din yan ng mga policies. We have our local policies and there is also international policies. And this has been set by the international companies dun sa nagre-require na yon. So with that, hindi natin siya mag-question kasi sila ang nag-require. Opo, opo. So, additional question, I think for Dr. For Dr. Cataluna. Doc, HBV DNA test is quite expensive in the Philippines. Is there any way we can offer assistance? Baka, syempre, being the hepatologist, mas alam nila kung kanino po. Referral. Is there any way we can offer assistance to help individuals afford the test?
Oo nga eh. Yung HPV DNA is really quite expensive, no? I think yung pinakamababa na in private institutions will be around 6,000, 8,000, can run as high as 15,000 for that single test alone. I'm not really sure if some of the big government centers like PGH, offer um, a lower rate for subsidized rate for HPV DNA testing. But unfortunately, it's probably one of the projects that we'll be looking at in subsidizing probably some areas for HPV DNA testing, because to be honest, it's really still a problem even for us as clinicians, gastroenterologists, hepatologists, where we could get a good rate for HPV DNA testing and to be widely available. So we'll look into that as one of our future projects po.
Yes, thank you very much, Doc. Need po din namin yan sa mga companies, di po ba? Kasi kailangan ipagawa yung HPDNA. So another question would be, can we clear a patient to work on food storage? So food storage po ito, wherein his work is direct contact with storage, and he is HBsAg positive.
Yeah, I think I think there's been a few questions about
Clear.
that. Workers in the food storage industry. Again, there is no EPP involved in this type of occupation, category 3. I hope Dr. Labanda agrees to that HBs antigen testing should not be required. On the other hand, what should be required would be Hep A testing as part of their screening, because Hep A, as opposed to Hep B, can be transmitted enterically, not bloodborne.
Okay, thank you. So same with the question po kanina. Then next questions. Additional question would be, Doc. I think this will go to Dr. Labanda. Immunization, Hep B, di ba kasama yan sa department advisory na
Yes.
kailangan may vaccination, immunization. Free po ba ito? 3 dose yan.
Okay, so based on the Philippine Plan of Action for Elimination of of Hepatitis B, ito po ay kasama na sa expanded program of immunization. Yung mga nasa age group naman po na hindi na umabot doon sa 1990s kung kailan po ito sinimulan, kung hindi ka po sa healthcare industry, maaaring hindi mo siya kakailanganin. Pero kung ikaw ay merong risk, so multiple sexual partners, high risk behaviors, then definitely you would need that. Syempre kapag ito ay may kinalaman sa personal na buhay mo, hindi mo siya pwedeng ipasagot sa iba kasi that's what you wanted. Then definitely you get the hepatitis B vaccine on your on your own. However, given that this is vaccine that you would want, you can approach our municipal health officers para po doon sa inyo pong vaccination. Kung ito po ay meron pong available for the adults, kasi alam ko po during our med school days, hindi ka pwedeng pumasok sa ospital nang hindi ka nababakunahan ng hepatitis B. So nandun pa ako sa age group na nagpabakuna pa ako kasi hindi pa siya kasama sa mandatory vaccination nung age group ko. Baka si Dr. Cataluna, nung time niya, na-vaccinate na sila before pumasok sa nung age group po namin, hindi pa po siya required. Opo. So, nagpabakuna pa kami.
Okay, thank you, Doc. Though marami pa pong question, pero last na lang po ito for Dr. Cataluna. Dr. Cataluna, question would be, hepatitis B vaccine po, completed yung all doses. Of course, we are Filipinos, we are Asians, prone tayo sa nag-zero convert ang antibodies, no po. Need po ba mag-repeat ng vaccination? If need, ilang doses po? If not, ano po ang gagawin?
Yeah. Okay. So I think this should cover category 1, no? Because the risk of transmission, the other way around naman, from an infected patient to the healthcare worker can be as high as 30%. That's why we advocate for vaccination of all high risk high-risk workers in the category 1. So in that sense, no, we usually test for the anti-HBs. More than 10 IU per ml anti-HBs level would suffice. The booster is recommended if it gets lower than 10, and the booster should be given at least every 10 years. And then especially if on a new application, I think in category 1, applicants should be required to have an anti-HBs also to determine their immunity. And if it's the cutoff is 10, it's less than 10, then we would advise booster shots. Just one booster shot would be enough for those who had previous good response to the vaccination. Otherwise, there are different guidelines for poor or non-responders. Usually, they would need another cycle of the 016 vaccination. But for those who have had good response prior, one dose of booster would suffice.
Thank you very much, doctors. So, very productive po ang ating hapon, no, when it comes to discussion on hepatitis B. Please allow me to wrap up kasi alam ko we have held your time long enough already. Just to highlight po yung mga natandaan po for this afternoon's lecture. On the lecture of Dr. Cataluna, of course, hepatitis is still an important public health concern, and the risk of transmission is actually, we can check for the risk of transmission it is dependent on the risk of exposure and infectivity. And with that, kaya po tayo nagkaroon ng category 1, which is high risk of transmission, category 2, low risk of transmission, sana tama yung pagkakatanda ko, no po? And category 3, negligible risk of transmission. And of course, ang ating po mga hepatologists based on evidence-based medicine, kaya din po nagkaroon tayo ng department advisory. Hindi lang po yun dahil sinabi ng gobyerno na dapat magkaroon, but it is still evidence-based, kaya po tayo nagkaroon ng advisory. And for the advisory, of course, under Department Advisory number 5 of 2010, wherein the guidelines for the implementation of workplace policy and program on hepatitis B, dapat po ito ay required, no, that workplace policy is required in all establishments. And this policy should have advocacy, information education, preventive strategies, no po, and social policy. Kasama po sa social policy ang non-discriminatory and part na rin po ng policy ang screening, diagnosis, treatment, and referral. Now, with that, bago po maghulian lahat, naidagdag po ni Doc Felix na although ang hepatitis B po is a policy, it's like an all or none. Tama po ba, Doc Felix? All or none policy. Kasama po siya sa all or none policy. Kasi dapat po hindi lang siya hepatitis B policy, but kasama yung HIV, AIDS, and tuberculosis. And we should not only address on hepatitis B, but as OH physicians, it is our role, hindi lang po para mag-clear or even mag-guide at manage ng ating hepatitis B diseases in the workplace, but we should also address their mental health condition. So that is also very important. So dear colleagues, we have now reached the end of our afternoon's lecture. It is very productive, no po, and very po siya, thought-provoking yung mga questions po na ibinigay po sa atin. And we are hoping that all of us have learned and relearned, no po, on hepatitis B in the workplace. And with that, my name is Dr. Eliza Hassen. I am from the Philippine College of Occupational Medicine. Please allow me to read to you this Arabian proverb. He who has good health has hope. He who has hope has everything. So wag pong kalimutan, malusog na tay, masaya ang buhay. Marami pong salamat sa inyong lahat.
Yun ang tagline kasi namin. Malusog na atay, masaya ang buhay.
Thank you, Ome.
May tagline, kailangan isama, di ba?
Yes.
Okay.
Good
Maraming
afternoon to
salamat
everyone.
po.
Bye.
Thank you, Dr. Cataluna. Thank you, Dr. Labanda.
Thank you, Doc Ella.
Thank you, Dr. Ria.